Hello, my name is Dr. Costello from the Harvard Veterinary Clinic, and we have our patient here today is Kitten. Kitten is Heidi's kitty. Heidi is a veterinary assistant here at the Harvard Veterinary Clinic, and we're going to just do a routine exam on Kitten, one that we normally do on every animal that comes in here for its routine immunizations. We're going to explain a few of the points that we stress on immunizations at the Harvard Veterinary Clinic. Now, Kitten is an adult cat. We'll first off start off with immunization of kittens. For the most part, we recommend that kittens be tested for feline leukemia and immunodeficiency virus, generally at about 12 weeks of age. We also recommend that kittens have booster shots, generally a series of about 3 shots, usually somewhere in about 6 to 8 weeks, and then on a monthly basis up until the point where they're about 16 weeks of age, at which time we also encourage people to have rabies injections given as well. The boosters are given to the kitties for a couple different reasons. One is that each of the fractions of the vaccine stands in alone of itself. There are different viruses. Each of these will respond in the animals at different times and in different manners. So what we do is follow a very regimented approach, particularly in the young kittens, of following through with an immunization pattern, as I said, on a monthly basis until they're about 16 weeks of age. Now, we also routinely deworm these kittens for roundworms and hookworms. We run routine fecal examinations on them as well to see if any other types of parasitism happens to be cropping up. The physical exam will show us if there's any infestations with fleas, ringworm, or any other type of disease conditions going on. We examine them for potential developmental defects and maintain good monitoring as far as their body weight, their growth patterns, their bone structure, and other critical components to go ahead and make sure that these kitties will go ahead and grow up to be a nice healthy kitty like Kitten. Now, what we're going to do here with Kitten today is we're going to go ahead and give Kitten one of her wellness checks before we go ahead and administer her injections. Now, first off, we're going to go ahead and check over the kitty, make sure the kitty... The reason we do the wellness exams is to make sure that the animals will have normal bodily functions. We want to make sure that they don't have any heart murmurs, that they do not have any lumps, bumps, any evidence of cancer. We want to check them over to make sure that it appears that their circulatory system is working well, there's no coughing, sneezing, or evidence of any other type of infectious diseases. We get a chance to talk with the owner and then see how the animal is progressing over the last year and if there's any abnormalities noted. For instance, as increases in water consumption, urination, things that would indicate that the animal would be developing diabetes or kidney failure or any other types of disease situations as the animal is progressing, as the animals age, and we keep a very, very close eye on these situations. Okay, so now Kitten, we're going to check Kitten's tummy and make sure that we don't feel any lumps or bumps. Now we're looking for evidence of pain, evidence of abdominal masses on the spleen, liver. For instance, if Kitten isn't spayed, we're going to check to make sure she doesn't have any babies. If she doesn't have any, to examine to make sure that everything looks okay on her urethra, her anal openings. Make sure that her feet look okay. No lumps or bumps on her back. No lumps and bumps on her leg, and she walks around fine. Now we're going to go check, see if Kitten has normal heart sounds. We're going to listen to her heart, see if the rhythm is normal. We'll see if she has any murmurs, any arrhythmias. Check to see if the sounds are appropriate, indicating enlargement. We'll also check on the chest to make sure that the kitty doesn't have any evidence of any wheezing, coughing, which could be infections, could be release forms of heart disease, sometimes even parasitism. Okay, now Kitten checks out pretty well. Teeth look real good, we know that. Kitten seems to be doing very well. Now, has Kitten had any problems as far as increases in water consumption or urination?
No.
Okay. Any other problems? Any throwing up?
No.
Okay. Any itching or scratching out of the ordinary or any of these things?
No.
Okay. Okay, so Kitten's going to go ahead and receive her injection here. What we're going to do is we're going to give this to her. Once again, Kitten passes her wellness exam with flying colors. She's a very, very healthy young little kitty, and we're going to put her back in her carrier so she can go back home.